Okay. Hi, and welcome to our fourth webinar entitled COVID and Health of Events. My name is Sheen Higa. I am the co-founder of Mandala Weddings, a media platform dedicated to helping provide inspiration and education to the South Asian and global event community. I'm one of your moderators today, along with Nurjri Desai of Kiss Cubed Events. Nurjri, say a quick hello.
Hi.
This is our fourth webinar to date, and in case any of you might have missed our previous webinars, you can find those webinars in the links that I'm going to provide in the chat box. Let me see, I'll give you one link here. Perfect. And
I'll put the next one in.
you put the next one in? Thank you
Yep.
very much. Okay. In the past 3 weeks, we covered a lot of different topics to help Indian wedding professionals navigate through the unknown. The first week, we titled our webinar, Surviving the Unknown, where we helped wedding vendors navigate through postponements, cancellations, and reevaluating their contracts. The second week, we covered insurance versus legality, where we covered when and why insurance was a must-have for every event. And last week, we covered the business of events, helping vendors become more financially secure post-COVID. Today, we're going to be discussing a range of things on the health of post-COVID. We'll be discussing what is really meant by the term social distancing. We'll be discussing for individuals and business and how to stay safe post-COVID. And we'll discuss from a medical and legality perspective, is it wise for vendors to put a safety clause in their contract? We'll also be discussing precautions and resources they should use to help them better work in different parts of the world as COVID continues. So while we wait for people to log on, I'm going to launch a poll. And everybody who's attending, if you could help me with this poll to help us serve you better for future webinars. Okay. So I'll allow that poll to go in. And all of you see the poll as well?
You can see it.
I just launched it for just the attendees. Okay, thank you very much for everyone for participating. And if everybody who is attending, if you could do me a quick favor, use the chat to tell us your business name, what you do for the wedding industry, and your Instagram handle. This way we can start following you. Perfect. Okay, I'll end the poll in about another 30 seconds. And I just wanted to remind you that the links in the chat are links to help you find our previous webinars. And in case you can't register or find us, we're also live on Facebook at Mandala Weddings. Okay, perfect. Thanks everybody for participating in the poll. So now I wanted to introduce my co-host and moderator. Her name is Nurjri Desai of Kiss Cubed Events, Brighter Elements by Nurjri Desai, and various other event industry endeavors. Nurjri and her company have worked globally to curate corporate and social events that are nothing short of unforgettable. Together, their goal is to work with the events community in our backyards and educate and elevate where our industry is going post-COVID and building collaborative vision for tomorrow.
Hi, everybody. Thank you guys so much for joining. I really wanted to take the opportunity to thank all of you, and I'm going to get started by introducing our doctors. Our first doctor is Dr. Bindya Gandhi, an integrative and functional medicine practitioner based in Atlanta, Georgia. She has her own practice called Revive Atlanta MD, located in Decatur. She has a holistic approach to healing and medicine. You can find her on Instagram. I'm going to be sharing all the information for all the doctors in the chat so you guys can keep up with them. Our second doctor is a childhood friend of mine, Dr. Mansi Sinha Jamin, and she is a pediatric endocrinologist at Mass General in Boston. She's an instructor of pediatrics at Harvard Medical School, a senior medical director for Covance, and she is part of the COVID task force for LabCorp. You guys can also find her on IG because she is a doctor that's very fashionable. And our final doctor is Dr. Rajiv Fernando, the first US-based physician to investigate the outbreak in Wuhan, China, and still remains asymptomatic after his return. He's the founder of Chiraj, a 501c nonprofit helping empower impoverished women and children facing poverty and injustice. We'll be sharing a lot more information about his nonprofit as well. He's done work for Homeland Security, and his current role is Chief of Infectious Disease and a COVID frontline responder at New York-based hospital systems. Wow, Rajiv. Well, guys,
I saw you losing your breath over there. I'm sorry.
I was trying to do it all in one breath, so that was just seeing if it was possible. But
don't forget. Let's mention Rajiv's Instagram, where people can find him.
Rajiv's Instagram. I just sent all the doctors' Instagram in the chat, so you guys can follow them and their information. But Rajiv is Rajiv Fernando MD. He will keep you informed and entertained at the same time. So make sure you check him out. So we're going to start with some of the questions that we've had. We're really excited about this because me personally, being a vendor in the event industry and executing events, I think a lot of people are really focusing on like contracts and all of that, but people and vendors also need to focus on the health of their staff, their own guests, including like their venue and all of that. So Rajiv, can you explain to me what it's really meant by social distancing?
Thanks, Narjeev, especially for your very generous introduction. Social distancing is a term where people are physically distancing themselves from outside the house. It's as simple as that. It's a very simple term. And obviously the number we know over here is 6 feet. That's the traditional distance that a respiratory virus spreads. There is some studies that might be more. The number we have right now for sure is 6 feet. It's a very simple definition. Really, if you're outside the house, social distancing, 6 feet. That's pretty much a very straightforward definition.
Great. Because I think what we're noticing is people are taking social distancing to different extremes and going into full isolation, which is causing a lot of other things that we could probably talk about later as we continue. One of a big question that I have is, based on your experience and data the medical community has, how long do you think we must anticipate quarantine? I think that's something on everybody's mind everywhere right now.
So what I see right now, based on what I'm seeing, for example, the mayor of New York, actually, about 2 days ago, he said, quote unquote, the worst is over. And I must tell you, in New York City, I've just seen the traffic double over the last 48 hours. We're seeing the usual traffic jams, a couple of car accidents. So, this is a very, very tough time where, Americans love their freedom. And the minute they hear something like that from the governor, things are going to start to shake down. And it's very concerning. It's important for people to understand. I do, as an infectious disease physician, I want to put everyone's health at priority, most important thing. But I also understand everything is a risk versus benefit situation. By asking people to stay home for more and more time, we're taking away their earnings. They're not able to go to work. Unemployment is going up. So it's really going to be a risk versus benefit situation. And I think this is one of the toughest decisions Americans will have to make over the next 4 weeks.
And Nurjani, one thing to speak on what Rajiv had mentioned about was the definition. So you do have social distancing as one piece, but you also remember stay-at-home orders. That's a different piece. So that's something you mentioned as far as isolation. So people are staying at home. That is the isolation piece. The biggest piece is social distancing. After that comes stay-at-home orders, and that's the isolation piece. And those have been working together in order to keep people safe.
No,
Can I
that's great.
Can I ask a very simple question? The suggestion of 6 feet, why does that come into play? What does 6 feet mean?
So initially, the data showed that the respiratory droplets that carry the virus went from 3 to 4 feet. So it didn't reach past 6 feet. So they're keeping that distance. If there's respiratory droplets in the air, this is the original data, by the way. So now there's more data saying that perhaps it goes further out, which is why everyone is wearing the mask. But initially it was 6 feet because they thought it didn't go beyond that if it was sprayed out of your mouth or nose or whatnot.
Okay.
So my other question is, I think this is probably geared towards all three of you, chime in whenever, but what recommendations do you guys have for individuals and businesses to stay safe post-COVID? This is something I think that's on everyone's mind. Anyone that runs a small business or a large business, we're all concerned, or anyone that's going to be attending an event, because we'll probably get more granular into that part of it soon.
India, do you want to take this one?
Yeah, so one of the things I was going to say is actually, small businesses are probably not going to be the same anytime soon, right? You have to understand that there's been a lot of changes. There's been some layoffs, some unemployment, furloughs. I mean, business structures have definitely changed because of COVID. So to all of a sudden expect tomorrow for us to be up and running like we were 2 months ago is honestly unrealistic. And so of course it depends on what kind of small business you have, whether we're in the event industry or we're just a mom and pop, bakery, whatever it is, business has definitely been affected, and it's definitely unfortunately going to change. So now what that means is after post-COVID is over, it's going to be a very slow integration, and it's going to be honestly a very slow growth, or realistically we're looking at about a year before all of us kind of look back to normal, what I mean go back to normal is to the income that we're used to seeing and what we were getting before in the small mom and pop shops, right? So
Yeah.
it's not going to change quickly tomorrow. I wish it were.
And I think this is also one of those where, we have, in the event industry, we have a lot of different caliber of vendors. And I think one of the things also is, we have folks that do this as their full-time business, and then there's folks that do this as their passion. And one of the things is also keeping the health of how food is produced, where it's produced, all of those kind of things. I mean, I feel like these are going to be things that really come into play, how certain businesses that provide, food related items, or even floral decor, anything that a guest can touch, it's really going to kind of change how things are installed, things are delivered, how staff is going to be working on site as well.
I definitely foresee a bunch of us, medical professionals aside, the general public is going to be a little bit OCD. I mean, we're all going to be a little bit more extra cautious about how close we're standing next to someone for months and years to come. This is going to be ingrained in our head. This is like the new future, that term needing space, really, we're going to take that to another level, and that definitely is important when it comes to the event industry, and we're waiting in lines at buffets at weddings, or we're doing barats or whatever it is, you're going to be a little bit paranoid because maybe you're a little too close to me and I need some space, right? So that's going to translate in various forms.
Yeah, I think it's a.
And when you're talking about the food piece too, as far as contaminations and how processing it's going to be, I think that's going to be part of the education piece. So for the folks that are providing the food, providing the vendor piece of that versus people who are attending these events, I think because people are going to be so overtly cautious, it's going to be important that you have even brochures or signs up that saying this is how we've processed the food, these are the precautions we've taken, because people want to feel safe. And education is the best way to do that, at least letting them know what you did to make their life a little safer as they're attending the event.
And we're actually going to probably expand on that part of it, Monzi, in just a little bit. I wanted to actually move on to another question I have, and this is actually for Dr. Bindia. Dr. Bindia, what are some tips you have that are remedies if someone catches COVID and can't get to a doctor? What are your suggestions they do to home remedy and self-care themselves back to normal health?
So honestly, first and foremost, if you have any symptoms, you definitely want to get checked out. Don't assume that it's COVID. Don't assume that it's allergies. Don't assume anything, right? Like, definitely go talk to a doctor. If you're not able to get in with a doctor, do a telemedicine consult at this point. But the thing is, get tested if you're able to. I know there's still a lot of people that are not able to do testing, but definitely get tested so we know for sure, is this COVID or not? Second of all, if it's COVID, everybody knows this: isolation. You don't want to infect anyone else, especially family members, the elderly, that kind of thing. But things that you can do to keep yourself better and recover, hoping that you're one of the people that don't need to go into the hospital.
Right.
You definitely want to, rest at home, get lots of sleep, eat the best quality, lots of vegetables and fruits. And I'm emphasizing vegetables over fruits because as much as I love fruit, and everybody does too, it's a lot of sugar, right? And so we don't want to feed any virus. We don't want to feed anything. If you're pre-diabetic, diabetic, you don't want to trigger your blood sugars from being out of whack. So definitely vegetables more than fruit. Stress reduction is probably the best thing that you can do. So unfortunately, all of us, everyone's stressed right now. Like, we're in a very heightened stressed state, right? And that is weakening our immune system. So if you're already have the virus and you're trying to beat it, the last thing you want to do is with additional stress. So, this is where things like meditation comes into place, right? If you're sick and weak, you're not going to want to do yoga. As much as I love yoga, you're going to want to sleep, rest. You're going to want to nourish your body. You're going to want to nourish your soul, and, definitely sleeping. Now, supplements, I'm a big fan of supplements, but don't start taking supplements without knowing what your medical history is and without talking to a doctor, but things that really help right now, vitamin D, again, it's boosting your immune system. High doses of vitamin C, because it's a great potent antioxidant. And again, it boosts your immune system. Things like andrographis really help. Traditionally, people take things like elderberry, echinacea during times of cold and flu season. And right now that's not recommended because that may trigger a cytokine response and that may worsen your COVID. So, just be careful, ask questions. Don't just start taking things blindly. But there's a lot of things that you can do to support yourself.
No, thank you so much for that. And everyone, you guys can follow Dr. Bindia. She'll continue giving you lots of great suggestions on her social media. Dr. Rajiv, this question's kind of for you. It's got multiple parts, and Bindia and Monty, feel free to chime in. My next question is, what do you guys foresee based on your specialty moving forward, how it will affect following events, businesses, large gatherings, children in events, elderly guests in events, and food providers?
Yeah, this is obviously, like you pointed out, this is really going to affect events all over the world. The way I'd like to do this is, as I'm thinking through, as a wedding. Let's start planning a wedding right now. So you are planning, what I feel right now is probably 4 weeks of aggressive lockdown is what I still think at the very minimum. If we're going to avoid that second peak right now, this is what I want to do. I'd like 4 weeks for sure. Anything else is a bonus for me. But then we have to keep in mind that this is going to be America's or the world's biggest decision on how to reopen economies. We're heading for one of the biggest recessions in our history. So let's take, for example, if you want to throw a wedding event and sometime in September, first of all, let's start with planning out the list. So we aren't talking about limiting the number of people who are coming to an event. You want to keep that small to your closest relatives. Like you want to keep it very short and small. You want to keep that list. Now, let's say we're hiring the hall. We're getting a place to hire. Try to find places where we can give a little bit distance. Obviously, I understand 6 feet distance is not attainable in certain situations, but we do the best we can, as much social distancing as possible. Now, before you plan an event, you've sent out your invitations to people. Make sure you put a little bit of a small COVID update on that. So when the person is reading the invitation, they already have a sense of comfort that they know the wedding planners are cognizant of this global pandemic and they're keeping their health in mind. So that's very calming. It's a good effect to give a current COVID situation. And another thing you can do, let's say a husband, someone to be married, the groom and the bride, what they can also start doing is preparing a list of people with their medical conditions. Now, to chime off what Dr. Bindia said with diabetes, the higher the diabetes, so we have an index called the HbA1c, which tells you how bad your diabetes is. So for someone with an HbA1c of 7.6, that's where we see the most severe disease. The other biggest risk factor I've seen right now is an elevated BMI of over 30. These are slam dunk risk factors. Elevated BMI, for me, is the single biggest risk factor when I see these patients coming to the hospital and we put them on mechanical ventilation. So assess the risk situation. Whenever you're throwing out the invitation, say, well, how old is he? What are the risk factors? Things of that, and plan events based on that. I have much more to say, but I'll let my colleagues go from there.
I'm going to chime in on the endocrine piece. So for the A1C BMI, so that's kind of under my specialty. And I will agree that I think what we're seeing in the US compared to other countries, what is that makes us more susceptible compared to some of the other countries? So some of the earlier data was there's smokers, there's lung disease, Italy, China. What makes us more susceptible here? And it often has been obesity and some of the other lifestyle factors that the US is specific to, some of the processed foods, et cetera. And so in endocrine, what we're seeing is when we've been tracking it, it is elevated BMI, obesity. So that means a BMI of over 29 is considered obese. And then when you think about A1C, so A1C, again, like Rajiv said, tracks your blood glucose, so your blood sugar. And you want it to be, relatively between, say, 80 and 100, 110. That's probably your safe zone. And A1C, if it's elevated, so anybody who has diabetes, specifically what we're seeing here, which is the type 2 diabetes, that is around 6.5% or more. If you have a A1C greater than that, you're likely to have type 2 diabetes. And if it gets higher than that, then you have uncontrolled diabetes. And so those are the factors that we're looking at as the endocrine community. And again, one of the main things with those that have COVID in the US really has been that they've had some underlying obesity. There's obviously some other things, but that's one of the factors that we've been tracking. And when you think about events, I agree with Rajiv, you're going to have to look at the population that you're inviting. And then from a pediatrics perspective, I think you're going to have to see like when it's going to occur. So you have to remember, we're going into the summer. Kids are not going to be in school, right? They're not in school now, but they're actually going to not have to be in school over the summer. And so they're not going to be congregating anyway. And then you're going to send them back in school, say end of August, early September. Now they're vectors essentially. And so they're going to restart another wave possibly. So you have to keep that in mind as well.
And one of the things I'd like to add is, when you're planning your guest list for your wedding or whatever event it is, right? Just kind of like what Dr. Monsi and Dr. Rajiv are saying is, will you be having kids at your event? Will you be having an elderly population at your event? How many people will you be having at your event? I mean, these are things to consider because, and I'm going to say this, and I keep saying this, it's going to be a very slow integration. It's unrealistic for us to think that we're going to have an event, June 1st or even September 1st, and we're going to have 1,000 people at our wedding. I think there's definitely going to be some sort of regulation when we start integrating again. So maybe it'll be like, okay, we can now congregate in 50 people, and now we can congregate up to like 100 people. And I think it'll be a very slow integration because, like everybody else, we do suspect another wave of COVID happening, and we have to be mindful who we're around, what age group we're around, what the at-risk population is. I mean, it's kind of, who wants to discriminate an event saying, well, I'm not going to invite you because you're young or you're old and you've got diabetes and you're obese, so I'm just going to invite like the 18 to the 45-year-olds that have a BMI of 22. Like, that's not going to be realistic. But at the same time, like, you have to look at all factors when you are planning an event. And unfortunately, that's just not something that we've had to do before.
No, that's absolutely great that, you guys have brought that up. That actually leads me into one of my next questions. Is that, do you think after COVID, different health regulatory agencies will go in and reassess venue capacities? Because that's going to be I think that's going to be a huge factor for people when they are planning.
Absolutely. I
Yeah.
think this is a very important factor that it'll be happening. And also I want us to also think about this. Unfortunately, I don't mean to say this, but the way these weddings and events have to be planned is really thinking about as someone would be boarding a cruise ship. You're going on to a cruise ship, and remember, one or two people infected can spread very, very
Everyone.
quickly. So thinking ahead, I think a lot of that's really the way to look at all these events. Like you're getting onto a cruise ship, prepare for the worst case scenario. Also thinking ahead, I think what we should be doing is, the wedding planner should also be talking to check out the local community. Now, for example, when you're planning a wedding, for example, this is not the time to plan a wedding in Queens. We're in the epicenter right now. So look at other options as well. Where are infected, and also have like an alternative. For example, I would say a week ago or 10 days ago, the Soviet Union or Russia, they declared no cases at all. As a matter of fact, they were giving all their ventilators, PPEs away. But now
Uh-oh, we lost him. Bindia or Mansi, can you chime in?
Yes.
I think, go ahead, Bindia.
So, I mean, I agree with what he's saying. You're definitely going to be reevaluating a lot of different things, especially during this time. But he's right when it comes to, thinking about where you're going to have your event. So if you're in New York City and, like they're reached their peak in the last couple of days, maybe you're not going to want to have your event in the city. You may want to move to another place where, there are less cases, or where other parts of the country, in Atlanta, we don't have as many cases as say New York does, but that's not to say in 2 weeks we may blow up here as well. So I think you just have to be vigilant, pay attention to where you think you're going to have your event, where you want your event to be. Are people going to need to be traveling for your event? That's important because
Right.
remember, if they're traveling, and I'm referring to by plane versus car, right? There's also risk factors being in a plane and who you're sitting beside. And so lots of things to think about, lots of things to kind of plan ahead. And that may, change how and where you're going to have your event. So maybe we'll see less likely people will be doing destination weddings. Maybe people
Right.
will be doing more small courthouse, backyard, barn weddings. Like, I don't know, and it may just be close family and friends, just because I think everybody's really scared right now. And especially for younger people, remember, like, you may not have any symptoms, but you may still be a carrier. So all these things to think about. And I know for younger people, they definitely don't want to expose their parents.
Right. And when and Bindia is talking about there's going to be a slow integration in society, it's the same way for events. So I agree. I think that you're going to have to start local, small, and then, because why would you add another layer of complexity by having a travel destination wedding where you have to travel quite a bit? And I think just if you start slow and steady, like the rest of the society, along with events, you're really going to have a better outcome for your business.
Absolutely. And that speaking of destinations, that kind of ties me into one of the other questions, is that many folks in our industry work in other parts of the world. What is your suggestion for precautions or resources they should use to help them better work in a different part of the world as COVID continues? Because I think that's going to be really important, because as much as destination events are going to stop right now, they're still going to happen. People are still going to want to potentially consider them. And I think that's going to be a huge aspect for all of us of like, what should we be as event professionals be guiding our clients to do? What resource should we have them use? Monty and Bindia, if you can kind of talk about that, that would be great.
Sure. Well, one thing I would suggest, I think, is travel insurance is going to change quite a bit, I think, from this. And from a perspective, someone planning say, again, we can take an example of a wedding, and you have people traveling to a place. Maybe it's outside, and we're in the US, or maybe it's outside of the US. And if you are going to have an event like that, then you need to have enough information for your guests. So on a medical front, I would want to know what clinics, what hospital systems are available. What does my travel insurance cover? Help the guests actually see if their insurance has some travel insurance based, depending on their provider, and making sure that once they get to where they need to go, and they do get sick, the pathway is clear for them as far as what's available, maybe what the cost may be, And, you know, even one thing I would even do is some things I do when I travel, in fact, is figure out where the closest pharmacy is. If I know that there's something going on in that area, and especially with COVID, these things are going to be absolutely essential for families to feel safe and people to feel safe to go.
And you know what? Data and things are going to be changing every day, at least for the next 6 months to a year. So, you know, just be vigilant, pay attention to what's going on in the world, where things are happening. Because right now, say you're planning a wedding in, you know, Cancun, right? And Cancun's maybe clear right now, but that's not to say 6 months from now, right? A couple weeks before your event, something could break out there. So, you know, pay attention to what's going on. Talk to the locals there. Whatever event you're throwing, again, we're going to use the wedding as an example, is talk to the locals there, because they're going to have the most knowledge. They're going to be able to feed you the right type of information and kind of tell you, okay, honestly, maybe we need to reschedule this event, you know, because there is an outbreak here, or it's getting worse, or whatever it is. So, and informing your guests and informing the other vendors and keeping everybody in the loop. I mean, it's, again, it's not going to be the same where, you know, everybody got an invite and let's all get on a plane and go to Mexico. And, you know, things are just changing and we just have to pay attention.
Absolutely. And you touched into this a little earlier. You were talking about the possibility of a second wave. And how long do you think this is going to last? And will a second wave of the virus happen soon? And is there a time frame?
So personally, I think, again, I'm no expert, but I think there's going to be a second wave probably October, November, once kids go back to school. Around that time, you know, that's when predominantly cold and flu seasons start, right? We start giving immunizations for the flu vaccine around August. So again, because school starts in August for us in the South. So that's my personal prediction. I think that's when we're going to have a second wave. And again, the other part of this is because I think people are going to get really relaxed. You know, they're going to get, we're going to, and I think Rajiv kind of alluded to this earlier, is when people start realizing, oh, you know, the cases are now, we're flattening the curve, you know, like we're steady, we're stable. I think people are going to be like, oh, I can go out more. I can do things a little bit more. I get my freedom back. And when that happens, I think they don't realize that their carriers are possibly infecting other people. They're, you know, getting the virus, that kind of thing. You know, you start letting things get a little lax. Maybe you're not washing your hands as much. Maybe you're touching your face a little bit more. Maybe you're, you know, talking to someone at the bus stop and you forget to wear your mask. I mean, that's just my prediction. And I think that's when we'll see a second wave. What do you think, Monsi?
I mean, I agree. I think it's going to be somewhere in the fall. And again, I think it's going to be related to a couple of factors. First, we're thinking about, hi, Rajiv, welcome back. So
Hi.
I think first we're just talking about the second wave. And so, so my answer to that is, I think what we're just seeing is a flattening of the curve is what we're anticipating over the next month or two. And that just means that we're getting less cases frequently. Right now, we're just getting them all at once. We're trying to slow that down. And what people are going to assume is that, yes, we have less cases. And in fact, we're just slowing the amount of cases that we're getting over time, right? That's flattening. So that is not the second wave. What we're anticipating is when we think the virus is in control, is when we have less admissions, less deaths, and over time, people can handle the volume in the hospital. That's when we're going to say it's kind of flattened, okay? Then we're anticipating another surge, similar to what we've seen again in the fall. And that's going to be when people go back to school. So some universities are even talking about shutting down college in the fall because they're anticipating this. I think there's talks about that. School system, so grade school, I mean, those are also going to, when they do start, again, kids are vectors. They carry things with them and they spread things. And I think we're going to see a resurgence through them. So I think some of the precautions that they're going to have to take is through the school system. But again, that all happens in the fall. So I agree with you, Vindhya, that I think the fall we're going to see that second wave. And I think that if we don't take the proper precautions, now that we've kind of learned from this, if we don't take the proper precautions, it's going to be worse. And again, just remember, coronavirus is a respiratory virus. Respiratory viruses happen at the fall, end of fall, through winter, early spring.
Yep, I agree.
And Dr. Rajiv, since you are on the front line, can you talk to us a little bit about that? About
Sure,
seeing
absolutely.
a second wave?
Sure, of course. Firstly, I'd like to thank my colleague, Mansi, for successfully taking my airtime away. She sabotaged the last 5 minutes of this. So thank you, Mansi. Very well done.
You
And,
well, I do this so well.
Very nice to be back. Truth is, I didn't pay my Verizon bill, but everything's also sorted out. Yes. Back to thing, so my take on this second wave is I'm hopeful. I really am. I hope with where we are right now with the cases going down, and I think with aggressive social distancing, we really have to work very hard at this. And Americans and people all over the world really need to understand that this can totally come back. The only reason you would see an abrupt sudden surge is really if the virus mutates. Right now, at this point, the virus is actually, affecting human beings very well. There's no need for any mutation because humans, it's got such an effective mode of transmission right now. So there's no need to think about a mutation right now. My hope is herd immunity will build. As we've seen this for the last 3 months in the States, which, by the way, I actually feel this was circulating sometime in December, either late December or early January. I'm pretty convinced this virus was here. It was just circulating, under the radar. But my hope is by the time we get to June or July, I really hope the country's seen a lot and we've developed herd immunity. People have developed immunity from actually having the disease. People have developed immunity in the community. So I know the CDC was, they were talking about, a second wave for sure, but I politely and respectfully disagree with that. I think as Americans, we have to continue to, and all over the world really, continue to be positive, continue doing what we're doing. And let's not think so far into September, October, or November. Let's just keep doing our thing right now. There's no need to be complacent. Unfortunately, you see, so even Anthony Fauci disappointed me the day he came out and said, we can expect 100 to 250,000 infections. And I don't think that's necessary. Giving those kind of numbers out there, it's unnecessary. We're not, take it to the bank. We will not have 250,000 deaths. Dr. Fauci is a god to me, but I'm going to politely and respectfully disagree with him in this situation. And I don't think we should be thinking that far ahead about a second wave. Let's take care of business right now.
Yeah, I think one thing, Rajiv, though, is that people, again, you've kind of already seen it, where people are saying that, when you start talking about thinking about the next month, the next 2 months, how we're going to integrate back into society, people take that as Dr. Bindi already mentioned, as their cue to go ahead and live their life. And I think that's the problem. So I think thinking about the second wave is almost mandatory, so people still know that that is a possibility if we don't take the proper precautions. I think that is why you have to say there may be a second wave unless you do X, Y, and Z.
I agree. Definitely.
Yeah, I agree. I think I think we should be exactly what I'm saying is we need to keep doing what we're doing right now. Just continue the same aggressive methods. Like you said, I think Dr. Bindia, I wasn't there for that time, but yeah, if your concept is that, I completely agree with you. We just have to keep being aggressive. We've lost a couple of days, I think, in New York City. Like I say, I've seen the traffic double in the last 3 days, actually. Just really things changed around as soon as the governor made that statement saying the worst is over. So we have to be really careful, politicians, healthcare workers, before we start going out into the public and making those kind of statements, which, gets the public reassured and say, well, we could get back to our life. Remember, Americans love their freedom. We're looking for something we're different from many other countries around the world. Of course, in China, it's very different. The government says you're staying in for 10 years. That's what's going to happen over there. Hopefully there are no Chinese vendors over here.
Yes, there won't be a baby boom after that one now.
Of course.
Rajiv, the three of you really bring up some amazing points. And I think one of the things is, I think that as being a small business owner, like many of the attendees that are actually on this, I know one thing that I really want to know right now is if the quarantining and all of that is going to last over another month or not, what are some of the things that I should be doing on the back end? And I think that's something that's going to be a big thing where instead of people focusing right now on it's the end of my career, it's the end of my business, all of that, because I think a lot of people, because of being event professionals who are out and about all the time, are having that level of thought. I think one of the things that we've been telling people is focus on your business, dig deep into your business, focus on restructuring, re-strategizing, maybe focus on not doing volume business, maybe focus on not being a mom and pop operation and be a legit operation. I think these are different things that like we can guide folks to do, but also keeping in mind, like, you know, where the industry is probably going to be going from a health standard perspective as we continue moving forward. I think that's going to be really, really important for everybody.
So one of
I
the
think you're
things-
absolutely right. Go ahead, Bindia, ladies first.
Sorry, one of the things that I wanted to say and mention was, you know, one of the things that I think everybody should look into, because I'm seeing this a lot, is yes, we do have a little bit of time. Yes, maybe we're focusing on our business, that kind of thing. But, you know, I'm seeing a lot more of anxiety, depression. There's a lot more mental health issues that are now starting to arise. You know, even though we're socially distancing, it's kind of turning into social isolation. And that's kind of what I've been saying is, so one thing, regardless of what industry you're in, what event you're planning or doing, is, you know, look into your mental health. And if there's something that someone you need to talk about, anything you need to talk about with anybody, or get some help, because I think sometimes people are feeling like they're alone in all of this. They feel like, oh, it's my business, you know, and I don't think they realize that everybody's going through this together, but everybody's going through this individually. That's the difference, right? It's because we're kind of, again, isolating ourselves because we're staying at home, right? We're trying to figure it out on our own. And I want everybody to know that, and I'm so glad you guys put this together, because I think it sheds light to that, you know, everybody's going through this together. Everybody is dealing with this some sort of way, and that there is help out there, and that there is something you can do about it. And of course, the way I look at it, knowledge is power, but understand that, you know, look at that, because I am seeing more anxiety and depression, at least in my patients. And
I think the other place
That's a good point.
Agree with, yeah, it's a really good point. I also worked with New York City over the weekend to do some detox admissions and rehabs. The alcohol withdrawal cases and heroin overdoses have skyrocketed, in my opinion. You're seeing so many. And even just last night, it was, we had a patient in the ward, poor guy, you know, he's from a foreign country, doesn't understand the language. We usually have, you know, we're able to explain in Spanish, but this gentleman was from another country. He didn't know, he was all alone in the ward. All of a sudden, like he was trying to kill himself. And, you know, these are real problems that we're facing. You know, I completely agree with Bintia, because this is really what's going to set the tone. You're going to have exacerbations of depression, anxiety. This is something we really need to focus on. And, you know, thinking we should have psychologists on board ready to go. We've missed the boat in so many instances. So this is something I think the healthcare community really needs to get behind and say, hey, listen, to reach out to our psychologists, our colleagues there, and say, hey, listen, we're going to need a lot of help from you in the next few months. Great point, Bindia. Thank you.
Yeah. I think one of the other things is also like Bindia was saying, it's not just like business owners. I think it's also like the staff and everyone. And, you know, that kind of really leads me into another question is like, you know, events not only service a large number of attendees and guests, but also a large number of staff. And like, just per your research, what are you guys foreseeing that'll help folks figure out a new way of operation as celebrations start getting continued to get planned? You know, I think that's going to be important, because as an owner of a business, I'm worried about my staff as well, because they're my backbone, you know, and I think every business owner is worried about that.
Yeah, I think
so from things that I've seen, so things from pediatrics perspective, I've seen, and this is more on the creativity side. So some businesses I know, even locally here in Boston, they've done like parade parties. And this is just like an example, because they need to make sure that people continue to work. So they're not able to have the same parties. I know that we had somebody who was a vendor who did balloons, and he did just only balloon figures, and then it would fill up the room for a party. And say that's an example. And what they've started doing is like a parade party. So it's two things. So they have their staff continue to, you know, go down whatever the house is having a party, they'll do like a small parade, but everyone is part of that. The staff is. So there's like 3 or 4 people. They're like, you know, in their own little cars, but they have a parade coming down. Then the balloon guy actually brings in the balloons, puts it in the front yard. Parents can take it inside and still have a party. It's a very limited way of doing it, but they have become creative. And I think, like, especially in our pediatrics community, I'm on a pediatrics board for COVID, and they're trying to figure out, like, not just schooling, but what about these parties that kids are going to miss out on, their birthdays? And so what vendors or in this area have done is they've had these support groups where they're actually going in saying, here's an idea I had. Who needs a job? You know, we need 50 cupcakes, or we need 25 cupcakes, and we need somebody to dress up and, like, go visit the house. It's one person. You can't go in, but you could do it from the yard. And as the weather gets better, I think you're going to have more creative outlets because of that as well.
Yeah, I think that's great.
No, Jerry, I might have misunderstood your question, but I think you were talking about the fact about your employees and how important they are to you. And
Yeah.
my suggestion on that topic is really have generous rules to stay at home as needed. The person who comes to work at you has to know that when they come to work, my owner's got my back. If I'm sick, if I don't feel well, generous, you know, you should just definitely let them go home, and generous rules. If they have to take some time off, just go home, get some time off. And it's up to you guys to really be as leaders for these groups, to just, you know, let them go back home and for them to feel comfortable in this situation when they come to work.
No, absolutely. And I think, you know, the other part to this question was that someone had mentioned to us on our previous webinar that was actually fitting for this one, is just from a medical and legality perspective, is it wise for vendors to put a safety clause in their contract? And what I mean by safety is that, what if you don't feel safe executing the contract or the event because you have a fear of getting sick? Because that's something that's been asked. And I think it's really important to, like, discuss, because I feel like I could go to the grocery store tomorrow before COVID and I could have come home with some allergic reaction to something. It's like, what I shouldn't go to the store, you know? So I think, like, I think that's something that's, if you guys can highlight on that.
I mean, you know, honestly, the way I look at that is it's now going to start spanning fear for other parts, right? It's like saying, Deirdre, you brought up a great example. Like, I'm afraid to go to the grocery store because I think I'm afraid to have an allergic reaction. You know, I'm afraid to do this wedding event because I already have high blood pressure and I'm afraid my blood pressure is going to spike up because it's so stressful. You know, like, I think that's going to translate to other parts of medical issues or medical problems, not just I'm afraid to work because I think I'm going to get COVID. Do you know what I mean? Like,
Right.
It needs to be very specific. The wording needs to be very appropriate, specific to the event, and it needs to be discussed with the client, and everybody needs to be on the same page, because, you know, when you put out general clauses in contracts, people can take it any which way. Do you know what I mean? And that could then lead for the bride and groom to say, I'm afraid that we're going to get COVID, so we want to cancel our wedding. Like, it can translate to either parties. Do you know what I mean? So it needs to be very specific. It needs to be very appropriate. And, you know, that's what I personally think about it. I mean, Monsi, what do you think?
I mean, I agree. I think that
We lost you, Monsi. Can't hear you. We can't hear you. I think she mistakenly muted herself. Rajiv, you want to fill in for her?
I'm sorry, I didn't get the question. I was troubled as well for a second.
What I was saying is, from a medical and legality perspective, is it wise for vendors to put a safety clause in their contract? For example,
Absolutely.
What if you feel safe? What if you or your staff doesn't feel safe executing an event because you have a fear of getting sick?
You know, I think this is, I know Monsi was answering this question, but I think it's very important, the climate that we're in, to anytime you're hosting an event, to check the local community, talk to the local health officials, see what's going on, coordinate everything with them. And also, I think it's very important to have, you know, something written written down to say, you know what, I hate to mention this, but the hospitals that I work for in Queens, we all come and volunteer, and we say we're here to save New Yorkers and save lives. And the first thing we sign on a contract is, if you get COVID, you're done. You're on your own, buddy. That's the contract that we sign. So, despite us coming and just putting ourselves at risk and things of that, that's the way it is. And it was almost shocking when I saw this. And I said, whatever, nothing's going to stop me from being on the front lines. It doesn't make a difference. But, that's the climate that we're in right now. And for all you vendors out there, I think it's a really good idea to think about these things. Whenever you're planning an event in your local community, talk to your health officials. The last thing you want these guys are coming up and showing up at your event and saying, hey, where's this? Where's that? Where's the policy? Did you get clearance here? No, you want everything to go as smoothly as possible. The other thing, it may not be directly involved with this question, but some things you can offer for family, elderly people, or immune compromised people who can make it to the function. Send them an iPad or something to say, hey, here's a live thing of the function of the wedding, to say, hey, you can watch this online and make them feel more comfortable. Mansi, what do you have to say about that?
Sorry, I just got back on audio. So can you repeat that question?
No, I mentioned Nurjari asked, about putting in regulations or disclaimers to say whether it's okay for, people when they're attending these events, that we should have the healthcare officials involved, and we should put in a disclaimer. I was just saying how, me joining this New York City response, one of the first things that I had to sign was, if I die from COVID, there's no responsibility from New York State.
Yeah, I think when you are planning these events, I think you do have to have some kind of liability clause, and inform the guests that are coming to attend. Kind of, these are what we're anticipating. These are the precautions we've taken, but enter at your own risk at almost. And these, I think it's going to be hard to navigate this, but the main thing is that you don't want to get stuck with a lawsuit, right? You don't want to go have people come into an event and then be like, I got sick at your event. So it's really important to be transparent up front with all the guests. These are the precautions we've taken. This is what the situation looks like in the area that you're having this event, and this is what we're anticipating. But by no means does this mean that you are, that we are responsible for your health at this event. And I think that's okay to say, because again, people are going to the grocery store still, and there's signs at the grocery stores here that are saying, we are not responsible for what you may come in contact with here. Please take proper precautions. And that is okay.
Thank you, guys. So we actually have some questions from some of the attendees that we want to address. One of them is asking, being a venue partner, how do we deal with clients in terms of health and safety, I guess, moving forward?
So specific to what? Like, what are you specifically asking?
I guess they're really asking is like, when a client signs them on, or a client's about to sign them on, what are some of the health and safety issues that they should be discussing with the client before they move forward with an actual confirmed booking? That's kind of what I'm getting out of it. Okay. Along with during the event.
So
I think that would depend on like where we are in the pandemic and what the dynamic of the disease is at that time, and also multiple factors like how many people are you planning to have and what the event looks like. What is the event? Number of attendees. That'll all play. It's multifactorial. It's not like one fits all.
Yeah, I agree with that.
Okay, so I think probably a better way for most people that are venues, you probably need to contact some of the health regulatory agencies such as DHEC and OSHA and all of them, and really have them come evaluate your venue and work with you on like what are going to be your new health and safety rules. I think that's probably going to be the better way, because essentially venues are, venues have to maintain certain caliber of scores, through these health regulatory agencies. So I think that's going to be a big part of it. But if in case anyone hears anything else, feel free, please email us, because we will continue sending information out about this moving forward. I think one of the other questions is, does collecting information about medical records on attendees impact our security?
So I don't know if you can legally do that, like collect like a health profile. I don't think that's going to be acceptable and okay. I don't think I don't think so. You know, like we have something called HIPAA. So
Yeah.
I don't know if unless I'm taking it to a different context, and forgive me if I am, but I don't think that's going to be the way to do it. Now, having a general conversation about general health, you know, prior to events, and kind of like, okay, this is our protocol for if someone gets sick, or if there's an outbreak, or, you know, someone has nausea, vomiting, you know, that kind of thing is a little bit different. But having a health profile on each guest and client, I think is a little excessive.
Yeah, no, I agree with you. I think future clients are only willing to disclose certain things, like if a family member needs a wheelchair, or someone is, you know, has a particular dietary restrictions or whatever. I think like or if someone's diabetic, because it just means like, you know, watch out for them. Here's some additional snacks or whatever. I think this is something that I think we're all learning, because I think it's gonna keep evolving on what we are able to do and what we are able to ask versus not. But I really feel like, again, these health regulatory agencies are going to really dictate what we can and cannot access, and which will eventually transpire into our event industry contracts. I think one of the other questions was like, will there be a flu shot or vaccination by a particular time? If so, what's the particular time? And will return to school help make this second wave not happen?
That's the $1 million.
So it won't be a flu shot. It will be a vaccine, but I'm going to let Rajiv take this because he just did a little piece on vaccines as well.
Oh my God, how nice of you, Monsi, to give me a question. That's so
I try to
admirable.
throw you a bone when I can, only when I can.
So admirable. That's so admirable. Thank you, Monsi. Thank you. So with regards to, get over it. With regards to a vaccine, you know, there are a lot of difficulties they're facing. I know they're going through, you know, trying to get an accelerated response, you know, going through all the phases really quickly. But a few of the people I've spoken to actually, you know, they tell me there are a lot of difficulties. And one of the researchers actually compared this to sort of HIV, where it's very difficult to get this working. Actually, it's quite complex. But our hope is, you know, what we were hoping was, you know, sometime end of the year, but, you know, I don't even think that's going to happen. So what I'm going to hope for is the herd immunity concept that, you know, we get out of this whole thing when all these people are infected. But if we're talking about the next fall, like in like 4 or 5 months, I don't think we're going to have anything ready. So we're going to hope and rely on the herd immunity right now. Monsi, what do you think?
Actually, I want to ask your opinion on this as well. So herd immunity, what is your timeline? What do you think?
With regards to herd immunity?
Herd immunity,
you know, yeah, no, I think it's a matter of, you know, 2 months or so, a month to 2 months after, with regards to herd immunity. I think it's a month or two when you start seeing immune levels boost up. So let's say New York City well, it's really hard. I don't want to comment right now because I think cities are still active right now. So it'd be really foolish to actually say, well, I was actually going to start and try to predict, but I said, I can't do it. We're still infected. We still have a lot of cases. So, I mean, my concept is once I think things have really settled down, we can shoot for a ballpark figure of 1 to 2 months, which I think will get herd immunity. And people who live in closer places, like say, for example, New York City, they live in closer, the density is higher. So people in more closer contact, they're going to get the herd immunity. So I think we just have to stop the virus right now. That's pretty much what we have to do.
I think one of the other questions that someone actually just asked us, guys, is that, is it smart to take attendees' temperature prior to allowing them into an event? If so, what temperature would you not allow someone in?
That's a great question.
I think,
and yeah, go ahead.
No, go ahead, Rajiv. No, go ahead.
Oh my goodness. Dr. Monsi, please go ahead.
No, I mean, I think that if you have to take someone's temperature to enter an event, you likely probably just shouldn't be having the event. That means that we're probably still in the midst of a pandemic, and it's not okay to have people come into these large settings. So I mean, that would be my opinion.
I think the gist of the question really is post-COVID, so that nobody's events are affecting or infecting other people. It's almost kind of like a safety precaution.
You know,
like
what?
When you're entering into a stadium.
So I think it's actually a good idea.
I understand that, but remember, people can be asymptomatic and still be carriers. People may not even have a fever or may not feel bad and they're still carriers. So, I mean, I think it's a little excessive, again, to be checking everybody's temperature prior to a baseball game, because if you're going to do that, then don't have the baseball game or whatever the event is, right? Like, it's just, if you're thinking that way, then it's going to ruin the fun out of just socializing and just going to events in general.
But
But
what do
I
you
guess
guys?
You can
what do
also
you
send
guys-
precautions too.
Yeah. No. What do you feel like if this happened? This has to go through. Someone's been engaged for a year. They're starting to fall out of love. And this event has to go through. And I think there's a sense of security. Actually, I'm just saying, things change. I don't know how people plan weddings 2.5 years. I just don't understand. God bless all of you who do that. Seriously. But anyway, coming back to this, I think it gives people a sense of security. And I really, a lot of offices, buildings all over Europe are doing this. I did this for, if I say I work for Homeland Security, Monsi's going to get upset again. So, but I did devise a protocol for Homeland Security where we checked everyone's temperature before they entered the island. So it worked very successfully. At the end of 3 months, I've only had one patient, one of the employees actually get infected with COVID. So I really think that people who come for the wedding are going to feel comfortable. They're going to have to understand. There is one legal situation which I have to mention, that you can't force to take their temperature. You have to tell them, listen, are you willing? If they say no, I mean, the other option, I mean, you're kind of stuck. One option is you can say, listen, I don't think that these are the regulations of this thing, of this event. I hope you understand these are outrageous times and they're difficult times. And I hope you'll oblige. We'd love to have you at the wedding. This is the kind of language I feel we should use. But I really feel at this time, checking temperatures is a very good approach. And it gives a sense of security also to the people coming in, that, the event planners have done everything they can to keep the audience safe.
And I think just to piggyback on that, Rajiv, I think the number one thing is that, like, and I'm not going to speak for the whole industry, but I know that we're all probably thinking this in the back of our heads, is that, like, we can't expect, we don't know when normalcy is going to be, but if these are going to be measures that we have to take to instill some sort of normalcy into our industry, because the thing is, we all have events like where clients are postponing, and right now, like, we're dealing with a lot of people still later in the fall trying to postpone, or now we're getting into that area, and before people start doing that, it's kind of like, why don't we create some protocols so that maybe these events don't have to get canceled, and this could possibly be it. And I think this is just a way of trying to really figure out what's the smartest and most respectful way to not only disappoint our clients, but also not to, making sure none of the vendors or anyone that's working gets sick, but, everyone's happy in the end, but still, like, maintaining some sort of protocols with it.
Yeah,
I think it also
completely
depends
agree.
on, like, the client and the guest, right? I think that you can also have something very similar in place, maybe short of taking their temperature at the event. But, ask them, send them lots of emails beforehand saying, 24 hours before, have you had a fever? Have you had these symptoms? Have you been around someone who has had these symptoms or has been sick? I mean, we do that in my clinic right now. I'm not allowed to go in if I've had a fever in the 24 hours or I've been exposed to somebody. And, and those are processes that need to happen regardless. And it depends on how frequently you want to send those emails and how invasive you want to be. But I think short of taking the temperature at the event, you can do a lot more before that as well.
I think, Jean, you had a question for Rajiv.
Rajiv, since you're seeing everything on the front lines, I would like for you to discuss a little bit about the recovery and how that looks, and talk to people about the process of recovering from COVID and moving forward and going back home.
Yeah, so it's really, I'm glad you asked that question, and I think it's an important question for our audience. It's important to know about, 80 to 85% of people who get COVID-19 infection, they just experience a mild upper respiratory tract syndrome, which is a little sinus, little congestion, and they actually get better. Remember, that's the vast majority of people who get COVID-19. It's about 80% of these people experience this very mild syndrome. the 80 to 85%, 10% of the people get really sick, admitted to the hospital with pneumonia, and another 5% really go to the ICU and get mechanical ventilation. So all this you've been hearing about ventilation and are we going to have enough? And I really think New York City is going to have enough. Take it to the bank. You know, we've been hearing this for weeks and weeks and weeks about 40,000 ventilators, but my assessment of New York City tells me we're going to be able to squeak through. We are going to have enough ventilators. So it's really important to understand when you hear ventilations, it only accounts for about 5% of people. So 95% or the 10% get pneumonias, hands down, they go to the hospital admitted. 80% to 85% really very mild syndrome. So I hope that's reassuring for all of you out there planning events. The vast majority of people have a very mild syndrome and they get better on their own. It's like what Mansi mentioned, from a diabetic perspective, you know, the obesity, the uncontrolled diabetes, and what Bindya also mentioned, some of her risk factors. These are the people who actually get very sick and get mechanical ventilation. So the vast portion, all of you out there watching, the vast portion do pretty well with COVID-19.
Great. I think that really kind of just helped everybody. I mean, is there anything else, like, you know, as our experts, you guys want to say, just because I think we need to wrap up shortly, but, you know, we greatly appreciate you guys being a part of this.
Absolutely.
And just helping us, because I think this has been very helpful for folks that are in the event industry or even couples that have possibly joined this on knowing what they need to do in the next few months or what they need to do with this time that they have and focus on some of the health aspects of running their business.
Sure.
Okay. Thank you for having us. I think I would say that, you know, use each other as a support. If you have a new idea how to support your business, share it. If you know that you had an event and it didn't go successfully, share that. You know, I think it's going to be a learning curve for everybody, regardless in which field you are, as we go back to normalcy, whatever that's going to look like. But I think having that open conversation and transparency will be important.
So one of the things that I wanted to add was, you know, thank you guys for having us on. This was great. But, you know, I agree, just like Dr. Mansi said, but we definitely need to be a community, use each other. And I'm so glad that we're talking about these things, because remember, everybody's going through the same thing. Everybody just may not know how to verbalize it or vocalize it and know where to get help. And so I think this is great that you guys are, you know, shedding light to different things and kind of help troubleshoot things before they even start. So I think this is great for not just the event industry, but just businesses in general, because this can translate to so many other businesses other than just, you know, events.
Yeah.
Absolutely.
And I'm sorry, Vidya, anything else you were saying? Sorry.
No, I'm good.
Thank you. And so thank you for Nursery for choosing this panel. I think all of us got along well. And, you know, I do want to mention one thing in medicine that we see. Sometimes we see phenomenon, which is the patient, and we always tell the patient, whenever we round with these patients, we say, hang in there, just hang in there, just go for it, fight. And I don't know what that is, where this mechanism comes from, and people just do better a lot of times. And that's why I also want to mention hope over here. We really have to be hopeful. We have to believe in our system. And like, you know, all of you out there watching, continue the social distancing. We can beat this. I mean, we went through the 1918 Spanish flu. We had a lot of death with a lot of affected people. We had a global recession, but we will come through. It's going to be a lot harder, but there are better days ahead than what we have right now. And just all of us have to pull together and, you know, just push through it. We have to have hope. That's really, really important. And as long as, you know, what my respected columnist had mentioned about all the measures that suggested earlier today to all of you out there listening, you know, I really think if we have those measures locked down for a while, you know, I think we can do really well. So have hope. I mean, we're going to have great weddings as long as you stay in love for more than a year and a half and your weddings are postponed. You know, we're going to have great time.
single and ready to mingle.
So we'll be taking applications for him so we can all bid on his wedding.
Thank you so much.
As long as
no
he only
bids.
has to date for under a year.
There are no bids, trust me. There are no bids.
Well, on that
Thank you so
note,
much for having
we're
me.
going to leave this on a very positive note. And one
Yes,
thing that I do want to ask all of our attendees, if you could use our chat box and tell the doctors, thank you very much for their insights, their inspiration, and all their great advice. We really want to thank them. Rajiv, I think you're working on maybe 2 hours of sleep, 20 hours,
Yeah,
20
man,
minutes?
I'm going to take a quick 2-hour nap and it's back to the hospital again.
Good, very good. So give us your thoughts in the chat box. And we want to thank you guys very, very much for your advice. And we hope that makes all of our attendees feel a lot safer, provides you with some insights on how you guys can move forward post-COVID. And don't forget, we're going to continue doing these webinars every Tuesday at 11. If you have more suggestions and you want to bring all the doctors back together, please tell us that by email, because these guys are great and we really loved talking with them today. So thank you very much, you guys. And don't forget, I'm going to put in the chat box where you guys can find a follow-up recap of this webinar so you can revisit the conversation, take notes, and apply that to your own business. So thank you very much, everybody, and we appreciate your time.
Thanks, guys. Greatly
Thank you,
appreciate
everyone.
it.
Bye. Bye. Thank
Excellent. Talk to
you.
soon.
Bye.